right. Well, welcome everybody. I'm Nora. I'm with the South Dakota Day of Giving campaign, and today we are here with Haden Merkel from the Mobridge Regional Health Foundation. Thank you so much for joining us today. We're here to talk about the Day of Giving and how you guys did last year and what you're looking forward to this year. And so, if you just give just a quick introduction to yourself and the organization that you work for.
Awesome. Well, thank you so much for having me, Nora. It's a pleasure to be here. My name is Haden Merkel. I work for Mobridge Regional Hospital and their foundational arm, Mobridge Regional Healthcare Foundation. And I am the philanthropy coordinator. So, like, most of my job is grant writing and like grant management here at the hospital. But we started the first capital campaign that our organization has had in 25 years. A year and a half ago. And so that landed on my plate. So I've also been doing a lot of donor development since then. And that's where we kind of came to South Dakota Day of Giving. So it was the first time we've ever done anything for year-end fundraising. So I kept hearing that it's the best time of year to be asking people for donations, like after Giving Tuesday into the like that third quarter is like 30% of donations or more for like the whole year. So I was like, well, let's focus there. And I found your guys' website, which is, and I did a webinar, one of those
Yeah.
early webinars that you guys did to kind of show like how an organization could start up their own day of giving. And then found the resources on there and started planning our campaign.
Awesome. As you said, you guys are kind of doing this big campaign, and we know we're one day. As you started thinking about this, and not that we need to, give us all your secrets for your big campaign, but how did you think about Day of Giving as sort of fitting into the campaign? Sort of what, maybe fundraising and definitely some monies, but outside of that, what kind of were your thoughts about integrating this into this larger goal that you guys had?
That's a really good question. So, our campaign so far has the folks that I go and talk to most, they're people that are already advocates for what we do, that are patients that have said how much our organization has changed their lives, or businesses in town. Like they've been more of the large donors that we've actually been having these conversations with. We've been trying to share as much as possible, like in the newspaper and in the radio about like what we're doing and why we're like how we're serving the communities that we're in. But we hadn't had a lot of great success with like smaller donors. I think it might just be because we have like a really large project, and so people are like, well, I could only give $20. Like, what's that?
Yeah.
I don't know if they really felt empowered to make a big difference. So what we wanted to do with South Dakota Day of Giving was to really say like, this is everyone's time. Like it doesn't matter how much you give. It's huge, it's important, and it's just as much about like showing support as it is about the actual dollar amount.
Hmm.
And we really wanted to use it as a way for people to feel like they were part of this. They were part of this big, building and renovation project we have going on right now. They can walk in when it's all done and be like, I helped build this, and have some ownership in the community of it.
No, that's
So,
great. And I love,
yeah.
starting with people that you know and then knowing that that's going to lead you to a wider network. As part of that, I know that you guys got a couple of really great matches as part of this campaign. We know that that can be such a huge just benefit to a campaign, but also motivating factor for people in your community and other donors, new donors, people who have been waiting to donate. Can you talk a little bit about maybe how you went about going some of those matches and finding the right fit and the people who were willing to step up for you?
Absolutely. So I actually think it was probably in some of the South Dakota Day of Giving materials that said, hey, you should try to find a matching donor. So I was like, all right. So we have a board member at the hospital who's she and her husband run insurance company here in the town. And I knew they wanted to give something. And I just wasn't sure like exactly how. So we were going to have that conversation anyway. This is part of that larger donor conversations that we were having already. So when I went to visit with them, I said, hey, I think we should do the South Dakota Day of Giving. And would you guys be willing to make your donation and have it be a match? And then they got really excited about it because they thought they're like, yes. And like, they're like, okay, well, I think originally they were planning on doing $5,000 as a donation. They said, let's bump it up to 10 because then we can make like a $20,000 impact, overall with this. So it was exciting for them to be able to have more of an impact and exciting for us because then we had something we could go to the community with. So fast forward a couple of weeks and I get to tell like the whole foundation board, like we found a matching donor. And one of the board members actually is like a market manager or market president of a local bank we have here in town, who we had also had previous conversations with about doing a larger donation. And we just hadn't come up with like what exactly fit best for them as a donor. Um, when they heard about the match, they were like, well, this seems perfect. So they went back to their organization and got in touch with me and said, hey, we've figured it out. This is what we want to do. And we also want to have it be a match for Giving Tuesday. So then all of a sudden it was like, well, we have two matches, which was wonderful. So we did a 2-to-1 match that day. And we did a lot of publicity around it. And ended up doing really, really well that day. And maybe we could talk about the other match later on, but yeah, we ended up having a third match, later that the actual day of giving.
I love this, and I love the snowball that you kind of see off of that, right? People sort of say,
Yeah.
"Well, I want to do that. I want to do," such a motivating thing to keep going. And I think as people see other people getting on board, that's the kind of energy that we really hope happens on the day of giving. That's our goal. Now, I know you guys did a lot of work up to this because not all of this happened on the day. And we know that we like, as part of our webinars, we start early, we've got lots to do. What was kind of leading up to that? I know you guys started doing some storytelling and some kind of getting out there with what you guys do in the community leading up to the day. Do you want to talk a little bit about sort of what you focused on as far as stories that you told or getting out to the community about the impact of your work?
Sure. So we put together a whole bunch of little like generosity saves lives kind of Facebook posts and different things, and they did well, but not nearly as well as our testimonials. So like we would do like it was super simple because we didn't have pictures of everybody. That's one thing I wish we had more of. But it wasn't bad. We had like we made it look like a 5-star review. So we
Nice.
had 5 gold stars on the top. And it was also kind of nice because people knew what they were looking for then. They wanted to see those testimonials. So we did a 5-star review and we put like a patient story. We have a lot of patients that say, like, wow, I was really impressed with my care. And a lot of times they say that to a nurse or a doctor and it just stays there. Well, we made a really concerted effort this last year and a half since the capital campaign started to be like capturing those stories and asking people, is it okay if we share your story with the public? And so we had a batch of them that we then turned into testimonials and we did one of them every week. And there were so many shares and so many likes and people know these patients. Like that's what really worked is like they were like, wow, like I'm so glad you're better now. And it was like I don't know, it was a real community
Yeah.
thing, and it's the best kind of storytelling we have to tell here, because we have rural health clinics and a critical access hospital and an amazing staff that does some crazy things in the middle of nowhere, you know. So yeah, that was one of the big things we did leading up to it. The other really big thing we did was engage our local media.
Mm.
So we did a lot of we told everybody what we were doing for South Dakota Day of Giving in the newspaper. Um, we talked to our radio station and we said, hey, like, yes, we can do a story and yes, we can do like an ad, but honestly, like, I think we could do something bigger. You know what I mean? Like, so we discussed it and we decided to do like a little mini radiothon, and it was only for an hour. But what we did was I went around to people at the hospital that you usually wouldn't be able to hear from. They're patient facing, so they're helping people while, instead of doing interviews most of the time. So donors, medical staff, and some of our administrators, and I went around and got audio interviews with them on my phone. And then we put together like a playlist, and then we sat in the radio booth and just chatted about the campaign. We had a little text this number to, text this code to this number and you can donate right now. So we had like people donating during the radiothon. And we had one of we found out really early that day that we were gonna meet our goal. And we were a little worried. So, it's a wonderful problem to have. We originally said we wanted to raise $30,000, matches included. So raise the $10,000 that would cover both the original match and then the first $10,000 of the second match. Because we thought that was a pretty good goal
Yeah.
for our first ever event. And then that we hit that like at 9:30, probably like 9:30 a.m. I was just you're just stunned
Yeah.
and so thankful. I was also worried that then momentum would just completely shut down the rest of the day and we'd lose that opportunity. Um, so I reached out to another organization that said that they were interested in doing like a larger match over a course of years, over a number of years. And I asked them, like, if you're really sure that this is what you want to do, I'd really love to have you join this because we are in a time of need just immediately to try to continue the momentum here. And they said absolutely. So they actually we made a plan that they would hop on and call in during the radiothon, and they called in and said, hey, we're gonna keep it going and do this additional match. And that got people excited on the radio. For weeks after that, I had people come up and say, I loved what you guys did on the radio. So it was really fun to hear.
Well, and I
Yeah.
love that, working with new donors, but also working with the donors that you have to help with that motivation. I thought that's just a really great way, like you said, keep that ball rolling. It's great. You're like, I hate to stop when we're on a roll. Let's figure out how
Yeah.
to keep this going. That radiothon I thought was what a great and interesting way to reach out to that local media. And with your community, it's a small community, like you said, we're really touching the lives right around us. And it's such a great way to get really out to your immediate community and get them motivated. As we're talking about this, I want to throw something out there. You're not a big team, are you? Like you're not a,
No,
you know,
no,
and so
actually,
how
yeah.
did you bring in, this, you guys did a lot. Who did you reach out to? I know it's like the staff at the hospital sounds like they helped a lot with, especially getting the story out. Volunteers board, how did you kind of spread the love and the work on this to make sure that it wasn't just you or, a small staff doing a lot?
Sure. So, the capital campaign, like it is usually me and then the executive director of our foundation here. So we were a two-person team. Um, and what we did is made sure that like we were talking about this with everybody we touched base with for the month and a half leading up to the event. And then we really focused on social media and press releases,
Yeah.
because we thought about doing like an event that day and we just didn't have the capacity to do that too. So we did have to like pick and choose, but the event we actually went down to the radio station and we were gone for an hour out of that day. And then the rest of the time we had to be here people were coming in with
Yeah.
checks. So it's like when I was gone, we had a guy come down to the radio station while we were on air with $1,000 and
Yeah.
said, this is in memory of my brother who would have supported this. Um, so so it was hard a little bit to have it in a small team, but at the same time, like we really focused on pre-scheduling posts
Mhm.
throughout the day because we knew that we wouldn't be able to man Facebook and be doing posts all the time. We got all of the interviews done way ahead of time, and then we could just because we knew we weren't going to have people
Mhm.
available to just all be down there at the radio at that moment. Um, and yeah, it like I said, we're a team of two, so you can do it. Like it is
Yeah.
possible.
No, that's great. There is, I love the pre-planning and sort of the recordings. And now you have those recordings too, especially those testimonials, right? It's something that you can, work amazing for this day and for the capital campaign, but hopefully also something that you can come back to, right, in the next year or so, and know that you've got those kind of in your back pocket too. So.
Right. Yep.
Well, just as we're finishing up, I want to just throw out what are maybe one or two things that you would just tell somebody who's thinking about a campaign or thinking about the Day of Giving and looking at this year. What are just maybe one or two things that you kind of tell them as your? I know you only did 1 year, but it was a great year and sort of head first into the day. What would your thoughts be?
Well, I would start earlier than what we started. We started November 11th. And it was like, and it was just because other things get in the way, and it's brand new. So we've got that like indecision of, is this right for us or not? I would have started earlier to try to get more content and honestly, it's kind of a year-long process. I think getting pictures, getting testimonials, getting stories from people. I think that's something that you could do year round, and then all of a sudden you have a really great opportunity to share it. Um, I would also say like I don't think we would have had near the success without our matching donors. Not near the success. So if you have people that are already advocates for what you're doing and that have the ability to do that are already planning to do a donation to what you're working on, and you can go and ask them like, hey, instead of a donation for this year, could you do a match? Like we would absolutely love it if you also donated, regardless of whether or not we received the whole match. But could we publicize that you're doing this as a match, and see if you can get some folks like that? Because yeah, I mean, I think that that was the big thing. Like we had people that would give $20, but they knew it was 60,
Mhm.
because of those matches, and that made a huge difference for people.
Yeah.
So I would say that, and then just the storytelling. Like we realized pretty early on that telling those stories from patients or from staff members, patients most of all, we even told some stories of donors. Like,
Yeah.
this is why I give. But telling those patient stories and like the impact that our organization was having was hands down like the most shared, most liked kind of post that we did. So
Well, great. Well, thank you so much for your time again today. And we're already getting excited about this next year for the Day of Giving. So we're excited to hopefully see Mobridge again join us. But also just thank you for your time and for all the work that you do in the Mobridge community. It makes a huge impact. So thank you so much.
well, thank you. Thank you guys for this event. Like it was amazing for us, and we really appreciate your support.
Thanks.